afternoon, everyone. I'm Hartford HealthCare's Tina Verona. Thank you so much for joining us for our media briefing today at noon. We have a very special guest to get to today for our briefing. But before we get to introductions, I do want to let the media know at 1 o'clock today, Keith Grant will be joining our neighborhood health teams at the Hispanic Health Council, where we will be providing boosters to the community. We hope that you can join us. It's 560 Park Street in Hartford. Just more of meeting the community where they are and responding to a need and getting those folks in the Hartford community those much needed boosters. So we hope you can join us at 1 o'clock today where Keith Grant will be. But for the meantime, right now, we have a very distinguished panel of guests with us. A special guest, Dr. Demetrius Bertsimas. He's professor of the Sloan School of Management and Associate Dean of Business Analytics at MIT. We also have Dr. Ulysses Wu, our Chief Epidemiologist here at Hartford HealthCare, and of course, Dr. Ajay Kumar, our Chief Clinical Officer. We're going to begin with opening remarks, and we'll start with Dr. Kumar.
Thank you, Tina. And just for everybody's awareness, Professor is not only a professor at MIT, he's my teacher as well, mentor as well. So he's been a wonderful partner for Hartford HealthCare for a long time. Let me start with our COVID details across the Hartford HealthCare. And I think we're going to have hopefully a wonderful discussion from analytical perspective of professors thinking about what the projections will look like. And I do want to highlight a few things as we go into the numbers. Our teams have been doing a chart evaluations of every single patient. We look into why the patients are getting admitted. And we have several patients in our system, almost about 30% right now, who are admitted because of unrelated reasons for COVID. So the numbers I display or talk about, we have to take in context of the many of the patients, rightly so, requiring care and seeking care for unrelated reasons than COVID. I happen to be rounding at St. Vincent Medical Center today, and while talking to the nurses, heard again that, I asked the nurses, what can we do to improve situation right now? And two of the nurses came to me and said, please ask people to get vaccinated and get boosters. And we are seeing individuals who have got vaccines and boosters have very short length of stay, mild or less intense hospitalization compared to people who have not had boosters or vaccination. So the context I want to present today with the numbers is to understand that many patients are seeking care for different reason than the COVID in the acute setting. So numbers could be misleading at times. And the second thing, the vaccination and boosters are really hallmark of prevention at this time. Now, by talking about incidental COVID, I don't want to minimize the impact it has on our care providers and nurses and doctors and everybody else. These individual patients require still significant care. And I also don't want to underestimate the impact of COVID on underlying conditions. Patients actually who suffer from COVID or who have COVID with underlying conditions generally have more complications as well. So the COVID does have an impact in overall health and healing at this time. So with that, let me begin with the number. Hartford HealthCare has today, right now, 535 patients across the system. 47 of them in Bacchus Hospital. Charlotte Hungerford has 44 patients. Hartford Hospital has 221 patients. Midstate Medical Center has 47 patients. Knotchak Hospital has 11 patients. St. Vincent Medical Center has 75 patients. Hospital Center Connecticut has 75 patients, and Wyndham Hospital has 15 patients. Out of that, we have 71 patients in ICU, and 50 of them are intubated or requiring ventilation support at the moment. And I discussed before, very few patients are who are ventilated have received vaccination, and nobody who's ventilated at the moment has received booster. So it just emphasizes the importance of having boosters and vaccines. So with that, I'm going to pass it back to Tina as you manage the panel. Tina, you're on mute.
We're going to go right to Dr. Wu. Thanks, Dr. Kumar. An update from you, Dr. Wu.
Nothing more to say. I'm just looking at the overall trend, and Dr. Bertsimas is going to provide much more insight into where we're going to be heading. But in the last week, it looks like that we are hopefully at the top of the curve because the rate of increase is not as dramatic as it was earlier. So, and we actually across the state from yesterday From the day before to yesterday, we actually had a decrease in COVID ventilation and the COVID ICU stays. So as we've said on previous media briefings, we do expect this to wax and wane, maybe have a little bit of a sawtooth pattern when you analyze it on a daily basis. But overall, the rate of increase is much less. So I'll stop there because there's a much smarter person on to talk about all this stuff than me.
All right, thanks, Dr. Wu. Without further ado, Dr. Bertsimas, I know a lot of members of the media have been anxiously awaiting your participation today. So I'm going to hand it right over to you to talk about some of the predictive modeling and how you come to light with your numbers and data. So please.
Thank you very much. So just a brief background on the modeling. We have been doing this since March of 2020, quite closely with Hartford HealthCare, and we have been updating the models ever since. We have worked closely with Johnson & Johnson for the preparation of where to do the clinical trials in September, October, November of 2020, and we have been updating the models ever since. Our models are part of the CDC ensemble model from May 2020. So we have been going at it almost 2 years now. So how about Connecticut? So the Omicron vaccine, the Omicron variant is, as everybody knows, is quite contagious, far more than any one we have seen. As a result, we have seen an exponential increase in the number of cases. And I'm afraid the model suggests that this will continue a bit further, in the state of Connecticut as well as generally in the United States. Now, it is the case that the rate of increase is slowing down. That's perhaps the first statement. But in terms of incidence, we are expecting pretty high numbers in the days and weeks to come. What is consistent with what Dr. Kumar mentioned, what we have seen is that even though hospitalizations and deaths are higher perhaps than in the past, proportionally, especially because of the vaccines and the boosters, the situation on that front, very serious effects from the virus it's much less. So we also expect an increase, but not as sharp. So unfortunately, the news that I have are not fantastic. So we expect an increase, not the rate of increase. We expect an increasing steady increase of the cases, and at some point. Exactly when, I do not know, when we'll find, it's in the weeks, not in the days. If you look at the history particularly of the Omicron in South Africa, where it originated, and Denmark, we have seen an increase and then flattening of the curve and perhaps declining. So I don't think we are there yet. My hope would be that we'll be coming in a few weeks from now.
Okay, thank you, Dr. Bertsimas. We're going to open it up now to questions from the media. Our first question comes from Nick Rondinone from Hearst, Connecticut Media. What trends have you seen with age demographics and outcomes among current COVID patients, and how has that changed since the high in April 2020?
Is the question for me
you
or
can
for
take it.
Ajay?
You can
No,
respond
Ajay,
first.
I think Ajay, how about you respond first?
I'll take a shot at that. At Hartford HealthCare, what we're seeing is that it's mainly about the unvaccinated or individuals actually who have been not receiving boosters. Especially unvaccinated, we are seeing increased number of hospitalization or mortality in younger cohort compared to last year at the same time. So I think the relationship is more about the vaccination and boosters than pure age. We have seen some age-related increased hospitalization, and I shouldn't say mortality, in individuals who have have had a prolonged duration from the time the second vaccination was given, and they have not received the boosters because of waning immunity at the moment. Our mortality trend is better. Right now, we have more tools in our pockets. We are a bit more proactive about the remdesivir and other medications we have right now. So we are saving more lives than before, but it still remains a significant challenge, especially if you're unvaccinated and boosters. And I cannot stress this enough, how much protective effect the vaccination has at this time.
Dr. Bertsimas, do you want to add anything?
No, I have the same response with Ajay. Just to reiterate, what we have seen is that in the earlier, let's say in the Delta variant version, in the previous wave, hospitalizations and deaths for those people that have the Delta variant were higher, much higher than the Omicron. In addition, we have seen strong evidence in the data that vaccination, and particularly boosting, makes a material effect in avoiding the serious complications, hospitalizations, and deaths. Very much consistent. And this is not only in the state of Connecticut, it's around the world. So I cannot overemphasize exactly what Ajay has mentioned.
Thank you, Dr. Bertsimas. Our next question comes from Tracy O'Shaughnessy, the Waterbury Republican American. A question about incivility and even violence directed toward hospital staff by family members and patients has been alarming. Have you seen that at Hartford HealthCare anywhere? Dr. Kumar?
I'll take that. Tracy, thanks for asking this question. We've been concerned about incivility, especially generally in society, and we've gone through a lot as a society for 22 months at this time for a variety of different pressures and challenges we have seen. Hartford HealthCare is a very compassionate organization, and we always want to stand on the side of the right and try to make sure that we meet the people where they are. We understand the stress everybody's going through. We understand the stress the families and our visitors are going through. I'd like to highlight the Hartford Hospital, Hartford HealthCare, till today remains open for visitors. We allow visitors, we welcome them to be part of the healing and care for the patients at this time. So the relationship we have in Hartford HealthCare with our colleagues, the patients, is different. And we have seen incidences of grievance going up. We have seen incidents of impatience going up. But we've not seen, fortunately, a direct physical violence or significant concern so far. And we are fortunate for that. And we are thankful for community's understanding on meeting our needs right now. I do want to underline, it has raised temperature a little bit in the conversations, and our nurses and the frontline providers are dealing with more of these grievances than before. But I think the operating model we've put together in Hartford HealthCare, where we welcome everybody with compassion and allowing patients and families to visit, it does reduce those interactions to a certain extent.
Our next question comes from Eliza Fawcett at the Hartford Courant. Dr. Wu, what are the specifics on the decrease in COVID-19 ventilation and ICU stays that you mentioned?
Yeah, specifically for the state, let's see, I have it right here. We actually had a -4 from the day before for COVID ICU. So that was our first decrease in quite since the last week before, but the COVID vents also dropped -9. That's for the state.
All right, thank you for that. Our next question comes from Andrew Brown from the CT Mirror. He has a few questions, so we'll just go, we'll just ask the first one first. How many staff members are currently out with COVID across the Hartford HealthCare system? How many total staff members are there in the system? Dr. Kumar?
Yeah, thank you, Andrew, for asking the question. So I just want to give you the context because you asked quite an important question here. Hartford HealthCare has 33,000 colleagues. And we also have many other medical staff members who are not employed by Hartford HealthCare, but part of the system because they work in our ecosystem in many ways. So it's a well-resourced organization with a significant number of individuals, almost about more than 1,000 working in support services such as finance and IT and many other areas. So the way our system works and consistently has worked from the beginning is that we help each other out. We work together as a team. So currently our IT department individuals are deployed in making sure the testing is appropriately managed, not giving testing obviously, but the logistical details on that part here. Our revenue cycle individuals are supporting registrations in different areas. So although we see the fluctuation in staffing volume, our teams comes together to help each other out. Most of the physicians right now, most of the nurses actually who has license are seeing patients or providing some sort of a care or being in the front line to answer questions about monoclonal antibodies or Paxlovid and other things as well. So the system actually does fluctuate given the COVID has impacted all of us in society. Now we've seen individuals leaving the hospital because they've got some symptoms, but at the same time as 7 days or 10 days when they get better, they come back as well. So it's a rolling average. The numbers could be misleading to talk about what the number of people are out at any given time, because we have such a good backup system in the organization to fill the need. And I hope that answers your questions.
He has another question. The number of patients hospitalized with COVID in Connecticut could break the record set in April 2020 soon if numbers keep ticking upward. I know Hartford healthcare leaders have said recently that roughly 30% of their patients with COVID are, quote, incidental, but don't COVID positive patients still place added pressures on the hospital system, even if the infection is incidental to the reason some patients are in the hospital? If so, can you explain what those added pressures are?
Andrew, what a wonderful question, and thank you for asking that. By commenting that the COVID patients are incidental, I don't want to undermine or write off the impact of pandemic it has on society or colleagues or the healthcare system. Individuals actually who happens to have incidental COVID but seeking care for broken leg or heart attack or something like that, it does put a pressure on our colleagues to make sure that they're wearing the right PPE. It's exhausting, isolation room requirement, and a lot of precautions which goes into managing those patients. So impact, without a doubt, it has in all of our process. But I think it's really important to understand what is the COVID-related sickness or illness we are seeing, and what we are seeing is non-COVID related when people need to take care of themselves as well. And I think it's really important for media and everybody to understand the hospitals are looking at the numbers. Is who's coming in for real COVID reasons? Am I short of breath? Am I requiring COVID care? Or I have broken leg, but I happen to have a COVID and I gotta get my leg fixed as well. So that's the pressure on the staff and resources. But also the outcomes could be changed. COVID in itself can create more complications while care for the patient, especially pulmonary complications and things like that. So it is not good for the patients as well. And that's one of the reasons I go back again, and I'll probably keep going back again and again. Prevention is the best policy right now. Reducing the sickness, the burden of sickness is the best policy right now. So vaccination boosters, again, please highlight in your articles as you go forward.
Our next question, Dr. Bertsemis, is for you from Tracy. South Africa saw a sharp increase and then a sharp decrease. You seem to indicate that won't happen here. Why not? What makes us different?
Wish I know exactly what makes us different. We are using aggregate models. Also, in the case, some differences between South Africa and the Connecticut population is that there are far more unvaccinated people in South Africa. I would say a closer model. I mean, I don't know exactly the demographics and the societal aspects in South Africa. I'm not that familiar. I've never been to the country. I'm more familiar with Denmark. And it is the case that in Denmark, we have seen a very sharp increase, and we are now seeing a significant deacceleration. But I believe we are behind. That is, Denmark is ahead of us. So if anything, I would argue, that the society in Denmark and the society in Connecticut are closer than Connecticut and South Africa. So I would say this is a stronger comparison. And the models are consistent in predicting what happened actually in Denmark. Namely, if I took a look at what was the early prediction in Denmark, what is the current prediction in Connecticut, and I believe we are maybe a month away from these developments. So this is where I have higher confidence. I'm sorry I'm not answering South Africa because I do not know the societal and cultural aspects of the environment there. I try to find what I think is most similar between two entities.
Okay, Tracy's also asking.
Before we go there, can we have Dr. Wu? He has an opinion on that. I know that.
Yeah, go ahead.
Yeah, I guess I do have an opinion. So, I mean, I think he's absolutely correct. It's difficult to extrapolate from society to society. So you look at a country such as Australia or New Zealand, who's, New Zealand, who was able for, if you all remembered, a period of time, they were able to shut their cases down to 0. And so there are definitely, I totally agree, there are totally different societal pressures that contribute to the rise and fall of the disease. The one thing I will make, and I do agree, Denmark probably would definitely be a much more similar analogy. South Africa, when they dealt with Omicron, was on the other side of the world. And by other side, I mean the upside down part. So they were in a completely different seasonal transmission than we are right now. And so I think I've said on previous media briefings, I do expect it to decrease. But it's not going to decrease sharply like it did in South Africa. And I've also said that, I expect, kind of a tri-humps curve with Delta fading out, Omicron coming back, that will fade out, and then influenza will come back. So if you take the overall curve and you take a 1,000-foot overview, I think the gradual decline will eventually happen.
Our next question for Dr. Bertsimas. This is from Tracy about Dr. Wu believing that the state will hit its peak by January 15th. Do you agree with that? And if so, why?
It's very hard to make these very short-term predictions, to say that in 15 days, in few days from now, we'll have a plateau. Our models do not expect that. They expect a further increase. I would say the further increase would be maybe in a several weeks time, as opposed to this week. Unfortunately, I'm expecting more cases, an increase and then plateauing, but we're talking a period of 3 to 4 weeks from now, not immediate.
Dr. Wu, do you want to add anything?
Absolutely. And so, as we've said on previous media briefings, it really depends what variable that we're actually following at this point. As I just stated, Delta, certainly we'll see the decrease from Delta, but we'll see an increase from Omicron. And the hope, and the variable that we follow, again, is the hospitalizations and deaths in the ICU. And I do not expect those to decrease until, I think I've been saying January 21st. So that would be 9 days from now. Now, a lot of this is based off of social behavior and off of weather patterns as well. And so we hit our peak sometime around the middle of January last week. And I think Delta is still going to decrease. I think Omicron cases are going to rise, but the hope is the hospitalizations will decrease. And I'm still hoping by this Sunday that we're going to hopefully see some decrease in that. But I do expect the percent positivity to remain elevated, going back to that tri-humped curve that I was talking about.
Our next question from Mike Savino at WFSB Channel 3. The FDA's commissioner said yesterday that she expects most people will get COVID. Do you think that's true for Connecticut? If so, what does that mean for how we move forward in the pandemic? Dr. Bertsimas, do you want to start with that?
I mean, admittedly, in a country like the United States that not too long ago had 1 million cases a day, it doesn't take a lot of days to get a sizable portion of the population. We also know that there are two different things that I would like to emphasize. One is incidence, the other is a severe disease. It seems to me that vaccination does not materially affect incidence of the Omicron variant, but it does materially affect serious disease. So my expectation is there will be a sizable number of the I don't know about everybody will get, but I would say it will be a much more significant number will get the Omicron variant than anything we have seen before. But the good news is that with vaccination and boosting, it's much less threatening regarding very serious disease, in particular death and hospitalization. So I think this is where, in my opinion, the game is played. And I would also like to say that longer term, my biggest worry is actually not the Omicron. It's really whether there might be other variants that the vaccines do not really affect. And I would say vaccinating the world, not only the United States, would be material, in my opinion, importance for the health of the world. Not only it's a much more global disease, and we should think about that. It's not just what's happening at Connecticut; it is what's happening in other parts of the world that would affect in the state of Connecticut in a few months.
Dr. Wu, or do you want anything to add to that?
No, I'm in agreement. So it's, yeah, I got nothing new to say.
It's hard to follow that up, right? Next question from Nick. Are there fewer people on ventilators and or in the ICU now compared to the peak of hospitalizations in April 2020?
Yes, Nick, that's correct. Almost 50% less.
All right. Tracy, follow-up question to Dr. Bertsimas. Your research and modeling looks at social behavior as a major factor in your predictions. Could you tell me what those are and how that makes your modeling different?
Yeah, what we do is we have a website that you are welcome to take a look. It's called covidanalytics.io, and we analyze on a daily basis data from about 180 parts of the world, all the 50 states in the United States and about 130 countries. So because our approach is data-driven, namely we look at the data in each particular entity, a state, we actually sometimes do it at the level of a city. We don't report it publicly in the level of a city, but we do it for other applications. So the data itself, even though it's indirectly affected by culture, for example, when we take into account the effect of a potential lockdown in a particular environment, let's say you do lockdown in Singapore, you have a particular effect where the compliance is very high. You have lockdowns in countries like where, so that I won't, but you realize different environments culturally respond differently to policies and so forth. So what we do is we look at the actual data in the particular environment. And this is also true in the United States. So compliance in the southern United States, compliance in the Northeast, compliance in the West Coast are not the same. So I cannot say exactly how people interact, but the data, which is the important aspect, suggests that the spread of the disease, the compliance of how people, even vaccination rates and so forth, is different from state to state. I don't try to explain it culturally. After the fact, one can discuss it, but the data directly affects the equations that govern these processes, and it's a quite substantial difference between different environments.
Tracy, looking for affirmation regarding the plateau. So you don't see that for another month?
Exactly, I cannot say, but I would say 3 weeks from now, maybe, of that order. I mean, is it 2? Is it 4? I mean, this long-term, these macroscopic epidemiological models do not have the clarity to say the plateau will be exactly then. I mean, I can only approximately say it, but I don't say, the models do not suggest imminently.
Yeah, and I think that is the key term here. We're trying to dissect this with the microscope, and you're absolutely right. Microscopic modeling for a disease such as this is going to be almost impossible to predict the day. Most of my modeling is being done based off of the previous year and the year before. So it's going to be gross generalizations, but I definitely agree. And that's probably the most important take home point, that microscopic modeling is going to be an inefficient venture at best.
Our next question comes from Eliza Fawcett from the Hartford Courant. Dr. Kumar, what is your response to the lawsuit filed yesterday by St. Francis against Hartford HealthCare?
Eliza, thanks for asking the question. Our team is reviewing the complaint, and our assessment is that the complaint is without any merit. Hartford HealthCare will vigorously defend these allegations. We deny any of them to be true. It's really focused for all of us at this time is serving the need of the community in Connecticut. Our teams remains determined and focused on making sure in this raging pandemic, we continue to pay attention to what matters most at the moment, is the health and well-being of the patients, access to testing, access to information, access to monoclonal antibody, access to care at this time. And our team's focused on that at the moment. We'll continue to focus. So I really can't say anything more than that, but these are without any merit.
And I do want to just reiterate, at 1 p.m. today, Keith Grant will join our neighborhood health teams at the Hispanic Health Council, where we will be providing boosters to the Hartford community. As Ajay mentioned, it is about that access, meeting the community where they are and responding to a very specific need as that. And we talked about the importance of getting your boosters. With that, I don't see any other questions in the chat, so we will now begin with final thoughts. And Dr. Wu, I'll start with you.
Not much to say. It was a pleasure to have our guest on as well, and it's good to see that we're in the same general ballpark about what's going to be happening. As we've said, there's a lot of variables that we have to take into account because Omicron is certainly a more transmissible, but we don't know its effect on how it's going to be on the hospitalizations and or deaths, which is really one of the markers that we're certainly looking at. I do want to reaffirm what Dr. Kumar has said, that many of these COVID hospitalizations are incidental. So there is a false elevation of the numbers. And somebody had asked the question previously about, well, it does affect hospital resources, but those patients are here for usually different reason, and to be here for a severe COVID would put an additional strain. So I'm just happy that our vaccinations and our boosters work, and that these people are presenting asymptomatic from a COVID standpoint.
All right, thanks, Dr. Wu. And our special guest, Dr. Bertsimas, if you have any final thoughts that you'd like to share with the media.
A critical, if you compare what was happening in the spring of 2020, late spring, April, May, where we did not have any weapons against the virus, we didn't have vaccines, we didn't have boosters. The situation now is, we as a society have much better equipped to address a very serious health crisis. And I would say, I would like to emphasize again how important it is for the population to be vaccinated and boosted. Unfortunately, I don't believe we are out of the woods. While the Omicron vaccine, the Omicron variant is perhaps not as deadly, if you like, as the Delta variant, the most recent one we have. It's still, unfortunately, we are still not out of the woods, but we have far more weapons against it. And I think we as a society and we as individuals should use them.
Thank you, Dr. Bertsimas, for taking your time to join us today. We really appreciate your expertise on the modeling. And Dr. Kumar, final thoughts.
Well, I'm grateful the professor was able to join today. You've been a good partner for Hartford HealthCare and guided our response and predictions and projections for a long time, and we appreciate your help. This is an example of how Hartford HealthCare brings some of the world leaders, some leaders from reputable organizations to assess and assist Connecticut's need at the moment. We'll continue to do so. As I indicated earlier on, our focus is that we remain open, visitors, patients, and provide access in all level of care to the state of Connecticut, and our focus will remain the same. Thank you.
Thank you, Dr. Kumar, and thank you to all of our guests, especially Professor Dimitris Bertsimas from the Sloan School of Management, Associate Dean of Business Analytics at MIT is his exact title for all of you. And we do hope that we see you at 1 o'clock today at the Hispanic Health Council at 590 Park Street in Hartford, where we will be administering boosters with our neighborhood health teams. Thank you all for joining us, and we'll see you back here tomorrow.